Case presentation on Asinapin's therapeutic use by Jessica Gonzalez, psychiatric mental health nurse practitioner student. In this presentation, we will include an overview of Asinapin, appropriate use of Asinapin in case study 1, and inappropriate use of Asinapin in case study 2. Conclusion, summary of Asinapin. What is Asinapin? Asinapin is an atypical antipsychotic serotonin dopamine agonist, second generation antipsychotic, also a mood stabilizer. Brand names include Safaris and Salkedo. Forms of usage come sublingual, tablets, and transdermal patch. Medication overview. In 2009, the FDA approved Asinapin for the acute treatment of schizophrenia in adults and manic or mixed episodes associated with bipolar 1 in adults. In 2019, transdermal Asinapin was approved for treatment of schizophrenia. Mechanism of action. Asinapin works by blocking the dopamine 2 receptors, reducing positive symptoms like psychosis and stabilizing affective symptoms. What are the off-label uses for Asinapin? Bipolar depression, treatment-resistant depression, behavior disturbances in dementia, behavior disturbances in children and adolescents, and disorders associated with problems with impulse control. Side effects: dizziness, sedation, hypotension, headache, blurred vision, extrapyramidal symptoms, akathisia, and rare cases tardive dyskinesia. Case study number 1, use of Asinapin. This patient is a 35-year Hispanic teacher that lives with her husband and her 2 children. She was referred by her psychiatrist. Source and reliability. The case study is a fictional example created to illustrate the usage of Asinapin in treating bipolar 1 disorder. Although fictional, it adheres to established psychiatric practices guidelines, making it a reliable educational tool. History of present illness. Patient reports experiencing irritability, insomnia, racing thoughts, along with feelings of hopelessness. Patient was referred by her psychiatrist due to the current mixed episode that she is experiencing. She reports she's not on any mood stabilizers due to adverse effects. Patient is currently on levothyroxine. Patient had lab work done 6 months ago by her primary care doctor. Psychiatric history. Patient was diagnosed with bipolar 1 disorder at the age of 30. She has been hospitalized twice to managed with mood stabilizer. Past psychiatric medications: lithium and Dipicam. But she's currently not taking any medication due to the side effects of weight gain and disturbing her thyroid issues. Substance use and abuse. Denies any use of illicit drug smoking or alcohol abuse. Medical history. Patient has no allergies. She has thyroid managed with levothyroxine. She denies any family history of psychiatric. She has no family history of addiction and no family medical history noted. Patient has a master's degree and works as a 6th grade teacher, supportive family but strained relationships, no hobbies. Mental status exam appearance needs: psychomotor, restless, agitated, mood labile, fluctuating between irritability and hopelessness, affect incoherent, insight limited, eye contact fair, memory intact, judgment impaired, speech language rapid and pressured, attitude cooperative, denies any suicidal or homicidal ideation, no additional findings. Physical examination. Patient appears restless and agitated. Her grooming and hygiene are appropriate to her occupation as a teacher. Vital signs are normal. BMI 27, a little elevated. Physical exam, no abnormalities were noted. Summary of assets and liability. The patient is a well-educated Hispanic female that voluntarily came to get help because she wants to get better. Her children and her husband are her motivation in improving her mental health. Liabilities. Patient has a history of discontinuing her medical treatment due to side effects of the medication. Case formulation. Diagnosis: differential diagnosis, personality disorder, emotionally unstable personality disorder. Final diagnosis: bipolar 1 disorder. Treatment plan. Justification for using Asinapin. Appropriate use. Asinapin is chosen for its efficacy in treating manic and mixed episodes with relatively favorable side effects. Profile. It is less likely to cause significant weight gain or sedation compared to other antipsychotics. Clinical trials demonstrate effectiveness of Asinapin in reducing manic symptoms and fewer metabolic disorders. Medication management. Patient will be placed on Asinapin 10 milligrams twice a day with the plan to adjust based on the response. Labs will be ordered: comprehensive blood pattern, thyroid labs. BMI will be closely monitored. Refer to cognitive behavior therapy. Evidence-based non-pharmacological interventions. Patient was advised to continue psychotherapy and to incorporate cognitive behavior therapy. Studies demonstrate CBT to be effective in treating frequency and severity of relapse bipolar, particularly in depressive disorders. Patient and family education. Patient was educated on the sublingual route of administration, advised to leave the pill under the tongue until it completely resolves. Avoid eating and drinking 10 minutes after taking the medication. Do not swallow or crush the pill. All side effects of medication use was also reviewed with patient's husband. Culture and diversity consideration. Hispanic patients may have specific beliefs about psychiatric medications, therefore may be cultural preference for natural holistic treatments over pharmaceutical interventions. Explaining the benefits of necessity of Cenepin in managing bipolar disorder is crucial. Possible adaptations. Building trust with mental health provider can promote adherence to treatment plan. Expected encounter and barriers. Patient previously stopped taking medication due to the side effects of thyroid and weight gain. There's a potential that patient can abruptly stop taking the medication. Case study number 2, when not to use a Cenepin. This is a 53-year-old Caucasian male that lives with his wife, no children, was referred by his psychiatrist. Source and reliability. The case study is a fictional example created to illustrate when not to use a Cenepin in treating a patient. The reliability of this patient is based on clinical evidence, realistic patient evaluation. While fictional, it adheres to established psychiatric practices, guidelines, making it a reliable educational tool. History of present illness. Patient reports experiencing auditory hallucinations and paranoid delusions. Patient was referred by his psychiatrist due to exacerbation of his current symptoms. Patient reports poor medication compliance with a long history of schizophrenia. Patient is not currently on any antipsychotics and does not recall what medications were previously prescribed by his primary care provider. Patient last received lab work a year ago by his primary care doctor. Psychiatric history, past psychiatric conditions and treatment. Patient reports diagnosed with schizophrenia at the age of 25, had multiple episodes of severe psychosis requiring hospitalization. Past psychiatric medication, risperidone, clozapine, olazapine. Substance use and abuse, denies any use of illicit drugs, smoking, or alcohol use. Medical history. Patient has no allergies. He has type 2 diabetes, poor controlled, hypertension, hyperlipidemia, history of myocardial infarction a year ago. Dad has psychiatric history of schizophrenia, no addiction history. Medical history, dad has cardiovascular disease, and the mother has type 2 diabetes. Development and social history. Patient is retired, has a supportive wife with no children, limited social interaction due to the paranoia. Mental status exam. Appearance appears disheveled, poor hygiene, psychomotor, restless and agitated, mood anxious, affect restricted, insight limited, eye contact, fair memory, disorganized judgment, impaired speech language, coherent, marked by paranoid delusions, denies any suicidal and homicidal ideations, no additional findings. Physical exam. Patient appears disheveled, poor hygiene, noticeable body odors, vital signs were normal. Upon physical examination, no abnormal findings. Summary of assets and liabilities. Patient's wife is an asset. The patient's treatment, she has been supportive through all patient's mental crisis and continues to offer unconditional support. Liabilities. Patient has multiple comorbidities that could potentially alter his mental status due to his history of non-compliance with all medical treatment. Case formulation, differential diagnosis, bipolar 1 and schizoaffective disorder. Final diagnosis, schizophrenia. Treatment plan, justification for not using a Cenepin, not appropriate. Patient's history of cardiovascular disease and poorly controlled diabetes makes a Cenepin a less suitable option due to its potential to cause orthostatic hypotension and its metabolic side effects. A Cenepin may worsen current metabolic conditions. Decision not to use a Cenepin. A Cenepin can exacerbate cardiovascular condition, placing patient at high risk for cardiovascular disease. Blood work order was comprehensive blood work, EKG, and monitor of BMI. Patient was referred for cognitive behavior therapy, continue follow with psychiatrist, family therapy, social skills training, lifestyle supportive measures. Treatment plan. Alternative medications such as aripiprazole selected due to lower risk of metabolic disorders, cardiovascular side effects compared to other antipsychotics. Dosage of 10 to 15 milligrams a day with adjustments. Evidence-based non-pharmacological interventions. Patient was advised to continue psychotherapy and incorporate behavioral therapy. Studies demonstrate CBT enhances adaptive coping mechanisms, contributing to better management of schizophrenia. Patient and family education. Detailed information about schizophrenia was provided. Education about potential side effects. Wife was educated on how to monitor signs of relapse, review lifestyle modifications, refer to primary care doctors for medication, follow up on all metabolic current conditions, reinforce medication management. Culture and diversity considerations. Mental health can be stigmatized in various communities, including some Caucasian populations. Schizophrenia in particular is often misunderstood, leading to fear of discrimination and social exclusion. Possible adaptations. Connecting patient and family communities, resources, support groups can help patient family feel less isolated. Expected encounter and barriers. Patient has a long history of non-compliance. It is possible that patient might not follow on medication treatment and discontinue medication. It is important to keep close follow-up on patient. Key takeaways. Importance of conducting a complete assessment upon evaluation. Importance of incorporating family into treatment plan. Detailed understanding of the use of a Cenepin. Importance of understanding medical conditions and the adverse effects that can occur when the wrong medication is prescribed. Summary. This exercise demonstrated the complexity of treating medical health conditions and mental health conditions, especially when there is noncompliance and comorbidities, cultural factors. It reinforced the need for a comprehensive, individualized approach to mental health care. Both studies served as a teaching tool for learning when it's appropriate to prescribe a Asinipen and when it is not appropriate. Thank you for watching.